Hello. Through this lecture presentation, I'm just going to go through the process of good quality qualitative research at a very sort of high level, and then a bit into depth on one particular way of analysing qualitative research. Some of this, particularly in the first half, is going to be quite philosophical in nature, and to be blunt, it can be quite difficult to grasp. It's a lot more information than realistically you need to develop a research question, but I think it's useful to provide this background information that is technically the quote-unquote right way to do things. You might come across guidance on needing to follow these steps. In reality, I'll get to a certain point throughout this presentation, and at that point, from there on, that's where you need to really be able to engage with and understand what I'm talking about. For the first sort of half, it's a lot more, as I said, sort of quite philosophical, difficult concepts to sort of get around, and it's not essential, but technically. Good quality qualitative research will use these terms and have these sorts of frameworks. So I'll get into that in a moment. So very broadly, qualitative research versus quantitative research, I'm just going to touch on that quickly. So some people, particularly in the health sciences like pharmacy, they perceive qualitative research as not useful and maybe more associated with other things like sociology and psychology and things like that. I was certainly guilty of this early on in my journey, but in reality, it's not less valuable. It's just to be used for a different purpose. So whilst we need quantitative research to answer the questions of, say, how many or how much, for evidence of outcomes of interventions, say for things like falls risks and major adverse cardiovascular events, we then need qualitative research to understand why and how an intervention works. So it's not a choice between whether we prioritize quantitative research or qualitative research, or whether one is better than the other. They complement each other and they have different purposes. And particularly for discussing quite complex interventions in certain populations and in healthcare settings, I would argue that qualitative research might provide not better insights, but might provide more, a little bit more context and background to make sure what we're doing is effective. So qualitative research aims to explore the social world. So through perspectives, experiences, and beliefs, we collect data with interviews and focus groups, often in observations. And through other forms of text like diary entries or written records and electronic medical records, or just by spending time with and observing people. Typically, we will see smaller sample sizes than quantitative research, and this is important to recognise because it doesn't reflect the quality. So in quantitative work, we might require a specific number of participants for statistical significance. In qualitative research, it's not about how much, but how thorough and useful the data is. So one single high-quality case study can be far more insightful than 20 short interviews or 10 focus groups. Analysis is another difference between qualitative and quantitative work. So analysis is driven by the researcher in qualitative work. And there are methods that I'll touch on regarding how we demonstrate rigor and trustworthiness. So it's not to say that we can do or say whatever we want. There are guides and there are rules to follow, but it's a very different approach. So strengths of qualitative research, they relate to the depth of the insights that we can gain. So for example, looking at a falls risk reduction intervention in aged care, quantitative data might demonstrate a slight impact of deprescribing interventions within the research project. But investigating the experiences and perceptions of those involved can help us to understand what can help us to implement this in other settings, how we can improve the impact of the intervention. We can look into why it's worked, and often, just as importantly, why it hasn't worked if it wasn't effective, and whether it's feasible to implement this intervention at scale. As with any research, it's got limitations. So particularly it can be vulnerable to bias, which is a controversial term, and I'll touch on this later. It's a term that shouldn't use, and obviously I have used it there. But it's probably the most easy way to understand it. So that there are ways to minimize this sort of. It's more of a positionality than a bias, and it can actually be a strength when applied appropriately. We also use quite small sample sizes, so inevitably we do miss some perspectives, and it is quite difficult to do well. So some people might see qualitative research as the easy option, but this is untrue. It's not as simple as interviewing someone, making some assumptions on what they say, and then making some sweeping statements about a theme. We can see a lot of published research that really doesn't conform to good quality research. So it's common to see research that is not necessarily done well, and it is because it is challenging to do well. So this is just a quick example of how qualitative research fits into important evidence-based interventions. And for some people, many people, I'm sure this is quite obvious, but for some you may not sort of recognize the value of qualitative research. So it's not just a subjective methodology only used by sociologists. It's got really important implications for real-world practice, and should be seen, as I said, as a complement to quantitative research. So when looking at hospitalizations from an intervention of a pharmacist-led deprescribing project, we can objectively look at the quantitative data and find out whether it works or not, whether it's reduced the number of hospitalizations, whether it's reduced falls risk, rates of falls risk, increasing drugs, things like that. Qualitative work can help us to understand why something has worked. So why did this intervention work? And as I said before, more importantly, why it didn't work. How can we improve it in future? How can we implement it in different settings? We can also help identify unintended consequences, such as emotional or psychological impacts. So following this intervention, when interviewing residents, we might see benefits such as improved confidence and psychological safety following the pharmacist intervention. Or we might see that the staff workload has increased, and that's resulted in stress amongst staff, which may have long-term impacts on staff retention. So there's a lot of practical applications of qualitative research. Now, here is where I get into the more complex and philosophical part. These might be terms that generally people won't have come across before. It is, as I said, not essential to understand, but I do encourage you to stick with it and wrap your heads around it. And do some further reading. So they can be difficult to grasp. It's useful to, when conducting research, particularly qualitative research, to have a good understanding of these terms because it informs the type of questions that we ask, how we ask them, who we ask, and how we evaluate that information. So these are the overall steps in developing a quote-unquote good research project in the qualitative world. So we start with our ontology, and that's our belief about the world. So it's the philosophical study of the nature of being, existence, and reality. So it's the study of the world around us and what we believe it is made of. So do we consider that the world is simply an objective reality that we can measure and define, or is the world shaped by our interpretation and the individual interpretations of each person within the world? Perhaps the easiest way to understand this is by thinking about colours in the sky. So if I tell you that the sky is blue, it's not a controversial statement, and I'm clearly taking an objective stance or an objective ontology, and that's my perception of the world. I believe that the world is objective and measurable by observation, and that's how I know that the sky is blue, because I look at it and it's blue. That's my understanding of blue. Someone else might come in and say that I believe that the sky is blue, but they might ask, does everyone else believe that the sky is blue? Does everyone else perceive colour in the same way that I do? Is it blue because it is blue, or is it blue because the systems in my eye connected to my brain perceive that particular colour? And does everyone else see that same colour? Does everyone else in the world see the sky as blue? What about people who can't see colours? It's not blue to them? And in fact, we know that the sky is not blue. We just perceive it as blue because of the refraction on the light spectrum makes us perceive it in that way from the cells in our eyes, the rods and cones. So there's actually no blue surface. The sky is not a blue surface. So consider for yourself whether you believe, is the world an objective reality, an ontology known as realism, or do we construct reality in our own minds, which is known as interpretivism? It doesn't need to be that we have this single ontology or way of viewing the world, and we can never deviate from this. But when approaching different questions, we might come at it from a different approach and from a different worldview. So it's a deeply philosophical concept and can sometimes be difficult to comprehend, and I appreciate that. And I really encourage you to read further on that. So two examples that lie on the different spectrums that I've just mentioned are realism and idealism. So realism is the idea that there is a single objective, unchangeable reality that exists. This then guides how we undertake research, because we will then use positivist approaches or classical science-based approaches that comply with the scientific method to find answers. So the sky is blue because we can ask 1,000 people what color it is. 99% say that it is blue, therefore it is blue. And we can run a statistical analysis on this survey data, and we will determine that it is blue. It is statistically blue. Alternatively, relativism maintains that the reality is mind dependent. So it's constructed within the mind of each individual. And each individual will then, because of that construction within their own mind, perceive a different reality. And that reality varies between people because of their own interpretation. So we ask people what color the sky is. They say blue. We ask them why it is blue, what makes it blue. And we discover that it is their perspective that it is blue. And then we speak to someone else who cannot see color, and they report that it is not blue. And someone pedantic and annoying like me will tell us that it's actually not blue at all. We just believe that it's blue because of the refraction of light into the rods and cones within the retina, and that's dictated by their understanding of other aspects of anatomy and refraction of light and that sort of thing. Now, the next term is the epistemology. So that's the next step, and that's how we come to know things. So it relates to how knowledge is constructed and how we create new knowledge about the reality of the world. So it's the philosophical study of the nature of knowledge, its nature, methods, origins, scope, and validity. So depending on our perception of reality, we may take different epistemological approaches. So if we take a realist view, we will typically use typical scientific methods of observation and measurement. If we were to take an interpretivist view, where we see reality as changing and context dependent, we would then take a more qualitative view to understand how these contexts and these perceptions and these underlying mechanisms shape the reality that we are observing. And I'm explaining these differences because it's important to understand, because they explain the nature of qualitative research and help us guide our choices. Common pitfalls happen with qualitative research when researchers they don't have a firm ontology, so they don't have a firm view of their reality, whether it's very idealistic or very realistic. So if they are trying to conduct qualitative research and they are undertaking interviews and focus groups and doing thematic analysis and this deep qualitative and subjective method, but then they're adding in these ideas of more positivist approaches that are more suited to realist perspectives, they might use terms, and I'll touch on this later, but data saturation and researcher bias. So those terms really don't fit with the ontology of qualitative methods, because when the data doesn't become saturated, because we appreciate that we can't reach saturation, we can't reach every perspective and gain enough data to have a statistically significant answer to the question. We can just move closer to the truth from gaining as many perspectives as we can, or as deep an understanding of someone's perspective as we can. If you move deeper into other qualitative work in the future, I'd really encourage you to look further into this, because it becomes a lot more complex, but also a lot more enriching, and it's quite interesting generally. So To tie these together a little bit, if we were to summarise different views or understandings of the aged care home back to this slide, we might a sociologist might come into the aged care home, and they'll come in with an idealistic or an idealism ontology, whereas a pharmacist might come in with a realist ontology. So the realist will say the aged care home is mind independent. We can understand it through observation and measurement, like quality indicators and rates of hospitalizations from this particular aged care home. Whereas the idealist will come in and say that, no, it's a complex system of relationships between people. We can't understand what's going on in this home purely objectively by observing what's happening, because it doesn't exist objectively. We need to get into the facility. We need to talk to people. We need to analyze their perspectives and immerse ourselves in it and understand how the people in there interpret their own world. So we have an interpretivist epistemology, whereas the realist will come in with an objectivist epistemology. Now, at this point, we're moving more into the more concrete, less conceptual stages, and it's perfectly reasonable from here to, if you haven't sort of followed along with the ideas of ontology and epistemology, that's fine. Focus on from here. This is where you really need to be able to apply these, but it is still valuable, I think, to have an understanding of those prior stages. Now, methodologies are the next step. Methodology is different to methods. So methodology is how we approach the design of the research. Methods are the specific steps of the process, so they are the recipe. Methodology is the broader category. Sort of what are we cooking? Are we cooking some bread? Are we cooking some cookies? It's going to be quite different approaches that we take, and then the specific methods within that recipe will dictate precisely what type of cookie we're making, what type of bread we're making. So there's various methodologies within qualitative research. I won't go into detail on these. They're all quite interesting. Phenomenology focuses on someone's experiences or a group's experiences of an event. So it comes from the word phenomenon. Another quite common methodology is ethnography, and that's the deep study of a group or a culture or a community. There's other forms, so grounded theory, qualitative descriptive methodology, which is a much more superficial way of diving into data, and then participatory action, which is related to co-design, and it's the collaboration between researchers and participants, and there'll be another presentation on that that you can go into. So if we look back at the broader ontology of a residential aged care home, if we're going to take an idealist ontological approach, it would suit qualitative methodology or interpretivist, epistemology or qualitative epistemology. And then if we are looking into how the facility functions, appreciating that it's a complex combination of relationships and interactions and contextual influences, we might then want to undertake an ethnographic study. So the researcher might spend days to weeks or hours within the facility making observations to take a deep dive into the culture of the facility, trying to understand the inner workings and the complex relationships and experiences of people. The opposite sort of, not the opposite, but an alternative way to view it through a quantitative or more realist ontological lens and a quantitative epistemology, a suitable methodology might be a randomized controlled trial, where we're trying to objectively measure the impact of an intervention or the differences between rural and metropolitan aged care homes in their opioid use statistics or something like that. Now, the next step is the methods of qualitative research. So this is the very discrete steps. So the methodology will often dictate the methods. So an ethnographic study will often contain a lot of field notes and observations written down by the researcher, whereas something like a phenomenological study, which is investigating someone's experiences of a specific situation or an event, will involve a rich, semi-structured interview. So this is how we collect the data, and then analyze the data. So this is probably what people are much more likely to be familiar with already. So you will come across a lot of studies that only refer to these aspects, the data collection methods, the data analysis methods. That's all part of the methods section. And then they go into the results and the discussion. They won't touch on the overarching methodology or the philosophical approach or anything like that. Sometimes you will, but you won't necessarily see that in papers. But as I said, it's a useful context because it will shape the way that you're interpreting things, and it'll make sure you're in line with your overarching planning for the research. Now, data collection consists very frequently of interviews and focus groups. That's probably the most common form of data collection. But you can also see, as I mentioned before, field observation and field notes. And there are even more interpretative approaches that involve researchers maintaining their own diary and analysing this, and that's known as autoethnography, which is an interesting sort of concept. Analysis then also depends on what we want to achieve, what suits our data collection method, and also the skill mix of researchers. Reflexive thematic analysis is by far the most common method of data analysis. Other techniques are realist evaluation and framework analysis. So, putting all of this together, we might want to ask a question such as, what drives inappropriate opioid use in aged care? A more objective or positivist ontology might come to this question and say, well, the drivers of inappropriate use are what we can measure. So we're going to look at the age of residents in the facility and see if older people are more likely to have chronic pain. We'll measure the ages of the residents and the likelihood of a specific age being associated with more pharmacological agents being used. We might also think that the staffing numbers influence it. So can we measure across 50 aged care homes their staffing levels and compare their rates of long-term opioid use and see if there's a correlation there? But if we were to take a more idealist ontology or perspective, we might believe that the drivers of opioid use are dictated by the individuals within the aged care system and their own understandings and interpretations of the world. We then might take an epistemological stance of interpretivism, wherein the knowledge that we create about the world is mind-dependent and it varies between individuals. And that fits in with our broader ontological stance that the world is constructed and constantly being constructed by the individuals. We then might choose a methodology of an ethnographic study where a researcher comes into the facility and spends time observing and exploring the interactions between the people within that facility. So they might observe whether people are being asked about their pain, how are they being asked about their pain. They might observe whether the people who are being asked, the residents, seem comfortable expressing their pain. They might interview some residents to ask them, they've been asked whether they're in pain or not. They've been asked to rate it on a scale of 1 to 10. Were they honest in how they expressed their level of pain, or were they fearful of potentially being a burden on other people? Were they comfortable expressing their level of pain to the staff? Have nursing staff potentially had negative experiences of seeing that someone's pain was poorly controlled? And are they much faster then to escalate therapy because of this experience? So in doing this, the researcher might make their own notes and record interviews, and then they might undertake a thematic analysis to develop a range of themes that they believe drives the inappropriate analgesia in aged care. So as I said, getting stuck into the method section now, the reflexive thematic analysis approach is likely the most common method of analysis that you'll come across. It was developed by two researchers, Virginia Brown and Victoria Clark, and it involves a 6-step formal process of analysis, and it's useful across methodologies. So it can be used to analyze data from an ethnographic study, from a phenomenological study, a qualitative descriptive study, and you'll also see a lot of research that doesn't refer to a specific methodology, and it just says that it's a qualitative study. This is done. It's common to do. Ideally, and very experienced qualitative researchers will say that you need to have a methodology, and it's not appropriate to do it without a methodology. But you will also see people doing what is called a qualitative study, and then they've used reflexive thematic analysis to do that qualitative study on one-on-one interviews and focus groups. It is difficult to undertake, so there's 6 steps to it. It comes across as quite simple, and it is often referred to in a very cursory way when it's published, and it's often referred to by advanced qualitative researchers as broadly done quite badly. So it can be inductive, which is where we develop a theory from the data without underlying assumptions or frameworks, or we can do it deductively, where we use a framework and then we come into the data with a particular perspective. So, and there's another model, which is a hybrid model, which sometimes can be called retroductive theorizing. And that's using a combination of both inductive or theory-generating analysis or deductive or theory-informed analysis. It's quite, as I said, it's quite flexible, but there are rules behind it, and these should be followed. And when writing about it and when developing a protocol and a plan, you should be quite specific on how you're actually going to approach reflexive thematic analysis to make sure it's aligned with the intentions behind that. So here I'll run through the overall steps of reflexive thematic analysis. I'll also go into later on some common errors and pitfalls that people make, and how we can make sure that we are optimizing the rigor and the validity of our work. So there's 6 primary steps. So the first step is familiarization, where we immerse ourselves in the data. Then we undertake coding, which is applying labels to discrete parts of a text. We start to generate themes, then we develop these themes and we review them. We constantly go back to the data and update our findings. Then we refine and define the themes. So we conduct a detailed analysis of the themes that we've developed, make sure they're clear and make sure they are consistent. And then we write it. So we make sure that we can communicate our findings. So the first step, familiarization. This process is where we immerse ourselves in the data. So it enables us to identify initial trends and patterns, and it provides us with a bit of a holistic view of the entire data set. So there's no correct way to do this, but it generally involves reading and rereading. So generally, often what we'll do is we will record an interview or a focus group. We will transcribe this into readable data, and then we'll just read it and we'll reread it. If we are recording it visually and with audio, we can also watch and listen back again and again. We can just listen back, or we can just observe. This sort of brings me to the actual conduct of the data collection. So often the actual process of collecting the data yourself, if you're intending on analyzing the data yourself, you can collect the data. That's not biased. So in contrast to quantitative research, the researcher being directly involved would be considered unblinded and often be considered a flaw to the research. That's not the case in qualitative research. And in fact, if you are the researcher who's undertaking the interviews and recording them, and then you're also analyzing the data, that can often be a strength because you're bringing your own insights and your own interpretation to that data. And that process of conducting the interviews and then re-listening to them, that's a process of familiarization. So you are really truly embedded in the data, and you are quite familiar with the data, hopefully, if you were paying attention. I'll touch more on bias and that sort of thing later, but yeah, it needs to be acknowledged that being the person doing the interviews is not necessarily biased if you do it well and authentically. Throughout this process, and particularly if you are conducting the interviews yourself or the focus groups yourself, it's an opportunity to identify initial assumptions and your positionality. So the positionality is the sort of the alternative phrase, and the phrase that should be used instead of bias. So it's your own context and your own who you are and who the researcher is. That's your positionality or your positioning. So it takes into consideration things such as your professional background. So are you a pharmacist interviewing other pharmacists? And could that influence your perspective? Now, could it influence your perspective in a way that you need to be constantly aware and reflexive of your position? And that's where the reflexive part of reflexive thematic analysis comes in. Are you being conscious of your own experiences professionally and how that may influence how you're interpreting what someone else is saying? Are you remaining close to what they're saying without abstracting, without interpreting it too much from your own perspective? It also includes things like your other demographic details, so your ethnicity, where you were brought up, your family dynamics, your age, gender, sex, all those sorts of aspects. They come into your positionality, which is where you as a researcher are coming from. It's important to recognize that is positionality and it's not bias. There's a way to do it in a way that enriches the data. So you come in, you might be a pharmacist coming in, interviewing some people who are also pharmacists, and you can bring your own insights into that data collection as long as you do it and document it very clearly. And I'll touch on that a little bit later. This positionality and this reflexivity should be done across the entire process. So you need to be constantly aware of who you are and what your background is that may be affecting the way that you're interpreting the findings. Now, the next step is coding. This is where we read and we start to generate codes. So at this point, we won't necessarily remember specific quotes, but we've got an overall feeling from familiarizing ourselves with the data, and we'll have a sense of any patterns that might be developing from the data. So these codes are the development of meaningful labels and components across the data set. So we start to identify specific meanings on the surface of individual phrases, sentences, or statements. So what we're doing is reducing the large set of data, which is potentially pages and pages of transcripts, into workable fragments of data. So I like to think of it as getting a few different jumbled puzzles together that are all mixed together. So we first need to, in order to put these together in their own puzzles and create each individual puzzle that looks like something sensible, we first need to turn all the pieces up the right way. We need to see the colors and the shapes, and we need to have them all together laid out in front of us in a way that makes sense to our brain. So having it in a bag doesn't make sense, but if we lay them all out, put them all up the right way, we can start to see sort of where things fit in and how we can sort of separate the larger individual puzzles and then also create those individual puzzles themselves. So it is inevitably interpretative. So we are interpreting each sentence, but it should remain as close as possible to the true meaning of the content. So we ultimately want to develop themes, which are broad conceptual categories of multiple potentially umbrellas of codes. But at this point, we're trying to stay true to the individual sentence or the words that have been used by the person. And this is really where reflexivity comes in. So constantly be asking yourself, have you associated this word with this sentence because that's what the person said and that's what they meant? Or have you brought your own understanding and your own interpretation to that in a way that really doesn't authentically capture what that person said. So here's an example of a piece of text that I have very briefly coded. It's a text about a registered nurse being interviewed about their experiences throughout the COVID pandemic running a manufacturing business. So, as I said, we're trying to identify the surface level content, not the underlying meaning. So in this transcript, the registered nurse is commenting up the top here that patients are fearful of the coronavirus pandemic, and we might code this simply as fear using their own words, which is often a useful way to do it. Now, this might imply an emotional response to the pandemic, but we want to stay true to the content of what they've actually said and not make assumptions too early. So I think fear is a reasonable word to associate with this. But if I were to say, well, fear is an emotion, I might say it's emotional. She's having an emotional response to this. That's taking it a step too far with the abstraction and sort of putting my assumption on that. So we want to stay true to the true meaning as close as possible that we can get. And again, that's where reflexivity comes in. This process is challenging, so we want to be true to the words and their meanings, but we also don't want to develop too many codes, too many words and separate words where it's impossible to put the puzzle together. So if we've got billions of puzzle pieces, that's unfeasible, and we're not going to be able to develop a cohesive storyline of some major themes. And we should be aiming for around 3 or 4 major themes. It's going to be really challenging to do that if we've got millions of discrete words that really aren't connected. By the same token, we also don't want to be combining them too early on and making these broad statements like using the word emotion, which can capture multiple things, too early on, because then we're going to miss very specific terms and very specific words and meanings that can, when we read and reread and reanalyze, that can be really informative. So using simple descriptive words is quite useful, and keeping a reflexive diary where you're documenting your thoughts and your decisions can be really useful. So that reflexive diary is a way to maintain that reflexivity, so actively thinking about it, but then also documenting your experiences and your feelings and why you've come to certain decisions throughout this process is really important, and that can add rigor to your analysis at the end and provide justification for what you've said, why you've said it, and your assumptions. Now, the next step is starting to generate the theme. So starting to pull, once you've coded all of these transcripts or whatever you've got, starting to pull together similar codes, things that make sense together. So start to correlate and group things into meaningful units. So we've already got the individual small units. Now we're trying to broaden them into categories. So this is where abstraction starts. So this is where we start to put our own, like the researcher positionality really does come in here. And we try to tie in similar trends and patterns. This is iterative, and it's a refinement of these initial themes, but also the codes themselves. So don't be afraid to go back to the original codes if you think reevaluating this, I said that this was fear, but maybe I might refer to this as apprehension, or there might be some other word that might be more appropriate, and you might associate that then with something else because you've further read other parts of this transcript, and now you say, oh, this I sort of understand a little bit more about what this person means behind this word. So visualizing codes at this point can be quite useful to see how they are interacting and overlapping or contradicting each other. So physically drawing out mind maps and coding trees can be really useful. Some people, what they do is they cut out chunks of text. So they'll print everything out. They'll cut out these little quotes or their codes, and then they'll start rearranging them into a bit of a mind map. Some use highlighters and pens, and you can also use software. At this point, we should, as I said, start to begin a higher level interpretation of the trends. So we don't want to simply summarize the text that's being said. What we want to do is look deeper into the categories and see the underlying meaning behind what's being said. We don't just want a list of barriers and a list of enablers and say that theme 1 is barriers, theme 2 is enablers. That's not a theme, that's a topic description or a topic summary. So it involves a lot of rearranging, reconceptualizing, and reframing of the individual codes themselves, and also the categories of codes. It's a lot of toing and froing to sort of look into the overarching meaning behind the data that you've got in front of you. So, for example, these codes that I put together, the fear, the avoidance, the protection, I might sort of say these are all sort of the emotional impacts of the pandemic on this person. So I might categorize that broadly as the emotional impacts. Their previous experiences also might come into that. So it's associated with the nurse's previous experience with another event. And we can all tie that all into sort of an emotional response. Whereas other aspects of this involve the financial impacts and the challenges to physical protection from the virus. So these I wouldn't include under emotional impacts of the pandemic at this time, at least, because to me they are quite different. And I might see a few other comments on things that are more logistical impacts. And they might start to be form their own sub-themes. At the moment, I don't think there's enough there to form a sub-theme for the financial impact, the protection, and challenges to protection. But emotional impact, I'm starting to get that from this text. And other people might have different perspectives, and that's fine. What I will do is think about how my experience, because I also was alive during the COVID pandemic, and I was also a healthcare worker during this time. What I'm going to put into my reflexive diary is how my experience at that time and my experience as a healthcare worker, I'm also the person being interviewed here is also a healthcare worker, how my experiences might be influencing my assumptions about what this person means when they're saying things. So I'm going to try and maintain my objectivity whilst appreciating that I am still inevitably interpreting from my own subjective understanding what they are saying. So we then come to reviewing the themes. At this point, it's useful to have a team with you. You might see people saying that you need more than one person to code. That's not true. You can just have one person coding. It's got its pros and cons. It's inevitably going to be a subjective process, but a lot of people, you might see people saying that you need more than one person coding because it gives you objectivity, or it gives you, it removes your bias. It's more useful to be able to check in with your own positionality. So getting someone with a potentially different positionality to see if their interpretation matches yours. And then you can be a little bit more confident that your own positionality might not be influencing negatively your interpretation of the data. So that's where I see it as quite valuable. And inevitably, everyone has insights. Every person will have different insights, and that can be really valuable for any work, but particularly qualitative work. This is an opportunity to ensure the coherence, consistency, and the differentiation between themes. So we want these themes or these sub-themes that we're developing to be coherent, so to make sense internally. So if we've got multiple sub-themes within a theme, we want them to be coherent with the ultimate theme and not be the same as each other, because they wouldn't be sub-themes then, but be consistent with each other. So in some way tied together by that single overarching theme. But we then also want differentiation. So we want the sub-themes to be different enough from each other that they make sense as sub-themes. And by the same token, we want each theme to be different enough to make sense as differentiated themes. And a lot of this, again, will be back and forward, reevaluating, reassessing, touching base with your team, discussing these themes in person, and rearranging where you've put the sub-themes, where you've put the themes. Is this theme truly a separate theme, or is it more connected with this other theme? Like, does it fit maybe more as a different theme within another theme? Or can we actually do these sub-themes, are they really different enough, and can we actually break them up, and this one theme then becomes two different themes? So something to keep in mind here is that themes are constructed. So one term you might hear is that the themes emerged from the data. Please don't use that word. The themes are not there and we're pulling them out. We are constructing the themes in our own mind from our interpretation of the data. So the themes don't emerge, we construct the themes because the researcher is actively involved in this process. We then refine the themes. So we define the themes and we name them. So it's the finalization process where we attempt to come to agreement on these final themes. At this point, we need to be able to define and describe the themes in depth. And we also need to select exemplars, which are generally going to be quotes directly taken from the text that support our themes or our sub-themes. This here, similar to before, is going to be a balance between depth and clarity. So again, the themes are not a summary of a topic. You'll see this a lot. It's quite common to do a topic summary rather than a theme, but a theme is an underlying trend. It's very it's not an explicit description of a range of barriers or a range of enablers. It's a rich analysis of the meaning behind the text, and it can be very challenging to get to this point and refine it, and that's where having a team behind you can be really useful. Now, the final step is writing. So here we are communicating what we've found and also how we've found it. So we need to include a lot of detail on how we haven't just read the text a couple of times, made some assumptions, slapped a bunch of labels on themes, and then presented it. We need to explain clearly what we've done to make sure that this is a rigorous method, just the same as we would do if we were conducting a randomized clinical trial. We're going to say who was blinded, who was not blinded. We're going to clearly describe the intervention, the analysis of the intervention. We're going to describe the demographics of the people involved, so that this research is meaningful when taken into another context, and so that people trust us, basically. So to optimize the trustworthiness. And we also clearly need to convey the theme. So we need to have a clear theme. We need to describe that theme in a way that is meaningful but succinct enough. And then we need to define any sub-themes beneath that. You often see people saying, we undertook reflexive thematic analysis as described by Brown and Clark. And yes, it's pronounced Brown, not Braun. Virginia Braun does not like to be called Virginia Brown, if anyone happens to meet her. So from this, we need to clearly document efforts to maintain authenticity, credibility, rigor, and reflexivity. So here are some tips for good qualitative research. So throughout the process, throughout the data collection phase, I would suggest starting to interpret the data, because this will inform, provided you've got approval to do semi-structured interviews, your interview guide can change over time, and it should change over time. If you're finding, developing new insights and you want to ask different questions or more probing questions. So if you're interpreting the data throughout this data collection phase, and that's fine to do, you're going to have different insights on further focus groups or interviews, or the next time you're visiting a site and doing your ethnographic data collection work. Be aware of your positionality. So it's not a bias, as I've said, but it is your positionality. So think about how your professional background, your personal background, where you were raised, where you live, how that might impact the way that you're interpreting these findings, and keep a good track of that through maintaining a reflexive diary. Now, this diary doesn't need to be a formal diary. You just need to be documenting your experiences throughout this process of data collection and data analysis, and how you may have been influenced by your own perceptions. And through documenting this and reflecting on this, you can try to avoid and work to avoid making assumptions where they don't necessarily fit. So maintain that authentic diary, and an audit trail process, which is the process of recording the decisions that you've made. So if you group certain codes into a sub-theme, why are these codes relevant to that sub-theme? If you name a sub-theme within a theme and then you move that sub-theme to another theme, why have you made that decision? So this creates transparency throughout the research process, so that if anyone asks you, why have you, this doesn't really make sense to me, why have you done this? You can go back and you can recall that I made this decision because I recognized, I rethought about my positionality, or after reading these other texts, I started to see that no, I've misinterpreted what they've said here, and I can actually see, and going back to watch the video, their facial expression actually showed that there was a different emotion that they were showing. So this text means something different to me now. Identify and maintain a consistent conceptual framework. And particularly what I'm meaning there is, if you're coming in to qualitative research, you're doing qualitative research. You can do mixed methods research, and that's fine. So you can do an interview, and then you can add on quantitative survey data to, it's called triangulating your results, and that's fine. If you're doing true qualitative research and you're coming in from an idealism or an idealist ontology, don't start using positivist terms like data saturation or bias, things like that. So just make sure you are aware of how you're interpreting these results, what you intend going in, and maintain that. That's not to say that you can't mix qualitative and quantitative together. There's a methodology called scientific realism that sort of sits in between that very idealist perspective and that very objectivist perspective or realist perspective. And then understand the difference between topic summaries and themes. Have you just summarized a category? Have you just listed barriers? Have you said the theme is barriers and then listed a bunch of barriers that people explicitly stated? Or have you gone into depth and really understood the behavior behind why this intervention is working or is not working, or why these people have had this recall of this experience? And it can be challenging, and it takes a lot of work. So to ensure good practice, and I put quotes good in quotation marks, because there is no arbiter of what is good and not good. There is, better and not as good, but there's no overarching body like APRA who will criticize you for doing something in a different way. But here are some suggestions on how to sort of increase the reliability and the trustworthiness of your results. So you want your results to be replicable. And this is done by transparent reporting of your methods. So you want to, that's why you clearly document what you've done and why you've done it, so that people in the future, they might want to do the same kind of study in a different context and compare it. They might do precisely what you've done. You've done it in a metropolitan area and they want to do it in a rural area. Someone's done it in Australia and another person wants to do it in New Zealand, and see what the differences are. You want your data to be credible, so you want your data to be driven by the findings. So this involves including quotes particularly. So making sure that you're able to tie specific quotes from the data, taken verbatim from the data, and apply that to the sub-theme or the theme, so that you can prove to the reader that you haven't just made this up yourself, or you haven't not considered your positionality, and a lot of what you've found is actually driven by your own preconceived understandings. It needs to be transferable, so you need to clearly understand the findings, the context, and the sample. So who did you interview? What's their background? What's driven their perspectives? And you need to document this so that people understand, you've interviewed these people in the aged care home. Who did you interview? Who are these quotes from? Is this the resident's perspective? Is it the family's perspective? Is it a locum GP's perspective, or is it the usual GP's perspectives? Is it a new resident? Is it an older resident? So as much detail as you can provide within reason. It needs to be dependable. So document your methods accurately and keep an audit trail. And it needs to be confirmable. So, engage others in the process. So peers, researchers, even participants. You can get feedback from people that you interviewed, present to them your themes and say, this is my taking from what you've said, what these other people have said. Does this reflect your understanding? Am I staying true to what you meant behind this? And you can do this with other researchers or experts in the area. Touch base with them about what your themes are, what their own understanding is generally, and does this resonate with them, either personally, professionally, or throughout their own research. And this is also where reflexive journaling comes in. So you can prove that what you've really considered your own positionality. Now, I've touched on these a little bit, but these are the terms to avoid in good thematic analysis. Emerge. As I said, the themes don't emerge. They're not jumping out at you. They're not popping up off the page. You are constructing these themes yourself from the data. It should be driven by the data, but you are, as the researcher or your team of researchers, are developing this. Bias is a quantitative term. In reflexive thematic analysis research, positionality is actually an asset when it's applied appropriately and when it's acknowledged. So if you're coming in as a professional who has experience in this area and you can provide your own insights into your interpretation, as long as you are also providing documented evidence of the participants and their quotes that reflect that, what you're bringing into this can be of value, and often will be of value. And finally, saturation. You will see this constantly. People will say, they conducted interviews, they got to 12 interviews, no new themes emerged, so they conducted 2 more to confirm that, and therefore they reached data saturation. Again, this sort of ties back into, are we undertaking an idealist ontology and epistemology and how we undertake the how we know about the world, or are we conducting a realist study where we're taking an objectivist epistemology where we're making measurements and we can numerically define, how much we need for statistical significance. If you're conducting Typically, in qualitative research, you're going to be very, very idealist focused. So saturation just does not make sense in that sort of area. It's a positivist term. We can say that we've developed all these themes, and no new themes are emerging. So at this point, we felt that it was appropriate to complete the research. I would avoid using the term saturation, though. These are my references, and thank you very much for bearing with me for just under 1 hour. Please, as always, ask me any questions. Thank you.